Before start the delivery process, this is all the equipments that we needed. This is a pad, glove, and we need a sponge ball, kidney dish, forceps, 2 cord clamps, episiotomy scissor, and 2 gallipods. Before start the delivery process, I would like to introduce myself to the patient. So, Madam, I'm Nabiha, 4th year medical student. So today I'll assist your delivery. So before that, I would like to see how far you have progressed in your labor. First, I will check your abdomen to see your fetal position, and then I'll do vaginal examination to see how far your cervix already dilated. Okay. So before that, you need to be in latotomic position first, and I'll expose you from below your nipple line to your pubic symphysis, and I'll expose some parts of your vaginal area lah. Is that okay for you, madam? Alright. So for abdomen examination, I'll start with superficial palpation. Palpate all the 9 quadrants, feel for any tenderness and contraction. And then deep palpation, I'll do fundal grip, lateral grip, and also pelvic grip to see the fetal lie presentation and also the engagement of the fetal. So for vaginal delivery, supposedly the baby should be in longitudinal lie in cephalic presentation, and the baby should be engaged. So next, I'll proceed with vaginal examination. Is that okay for you, madam? This will be a bit uncomfortable for you, but if you do feel pain, please let me know, okay? So first, before that, if the bladder is still not empty, I'll empty the bladder first by using Foley catheter. And now, I'll clean the perineum. Check for, inspect the vaginal and also the vulva. And I'll insert 2 fingers into the vagina to see the dilatation of the cervix, the station of the baby, molding, liquor, the position of the fetal head, and also any presence of cord. Before delivery, I'll make sure that the CTG is reassuring. So before that, I'll do vaginal sweep to ease the delivery. And once the head is crowning, I'll check for any need for episiotomy. So, and also I'll like to guard the perineum to support the fetal head, and then I'll apply downward pressure on the fetal head. Push. Push. Okay. Once the fetal head is already out, I'll check for any presence of cord around the neck and wait for restitution. After restitution occur, I'll apply a downward traction to deliver the anterior shoulder of the baby, and upward traction to deliver the posterior shoulder of the baby. So once the baby is already out, I'll put the baby on top of the mother's abdomen for skin to skin touch, and cover the baby with clothes immediately. So after the baby is already out, we'll wait for 30 to 60 seconds before do the cord clamping to improve the iron store to the fetus. So and then we need to clamp. First clamp is near to the baby, and second clamp is near to the placenta. and then we need to cut by the cord by using episiotomy scissor. So after cut the cord, we need to administer uretonic agent. Okay, done. Administer. And then we need to wait for the signs of placenta separation. There are 3 signs. The first one is gushing of blood, lengthening of the cord, and the uterus is becoming more harder and globular. So after there's signs of placenta separation, I'll pull the cord downwards, and another hand push the fundus upward. Keep pulling, and okay. Once the placenta is already out, I would like to check for any missing cotyledon, check for the color of the cord and the placenta, and check for presence of 1 umbilical vein and 2 umbilical artery. Once the placenta is already out, I'll check for any insert 2 fingers and check for any retained placenta, any perineal tear, and also check for any anal sphincter tear, and also do estimated blood loss. And lastly, I'll clean the perineal and pack the perineal area with